Sakit in the same way. Dahil lang nag-invento po niyan is dahil sa loob po dapat yung puti. And when you say, kung wala ka namang sakit, pwede mo bang ibaliktad? Actually, hindi nyo po alam kung wala kayong sakit eh. For example, if we promote that and a person from China came in, tapos binaliktad din niya, di bahing siya ng bahing sa loob, lumalabas. Kasi hindi ina-absorb eh. And number 2 example, for example, ganito yung pagkasuot ko. So may nagbahing, pumunta yung virus dito, kumain ako. Tapos pagbalik ko, sabi pwede baliktad. So ano nangyari? Yung virus diniliver ko sa harapan ko. So hindi po pwedeng ibaliktad. And how to use it properly is don't touch the outer and inner, only the cords. Tapos fix the upper area. So kung matangos yung ilong nyo, talagang ganun. Kung hindi naman matangos, ganun nyo na. Tapos pull down nyo po yung ilalim. Now, with regards to the protective power po niya, is not really that protective because may loose areas po tayo. The main purpose po ito is to protect all of you from me. So kung ako ang may sakit, I have to wear this one.
Dr.
Kasi
Mata,
absorbent
question lang po. Sa katanungan ng karamihan, ang may sakit lang ba ang kailangan magsuot ng mask o kahit na walang sakit? Kasi nagkakaroon tayo ng shortage sa mask ngayon kasi sabi nila nagpapanic buying. Yung iba naman po hindi raw kailangan magsuot. So ano ba ang dapat?
Okay, thank you for the question, Your Honor. Ideally po, in this time of shortage, yung may sakit lang sana. So in other words, kung yung may sakit, siya lang ang susuot, tayong lahat ay safe na. We don't need to wear. So kunwari, 5 lang sa room na ito ang may sakit, 5 lang yung gagamitin natin. Pero kung yung may sakit, ayaw niyang magsuot, then tayong 100 ang susuot nito. So it goes to the discipline as well. So kung hindi sila mapilit na magsuot, then magsuot ka na lang. So it's still on the discipline side na kung may sakit ka, please, you have to wear this one.
Ano ba kailangan suotin? Yung isa, yan mas manipis o yung N95 ang dapat?
Okay, for the question on N95, yung power po ng N95 is talagang sealed po siya. So if I'll wear this in this way, as you could see, halos hindi na ako makahinga. Nahihilo na nga ako eh. In all honesty, it decreases your oxygen by 20% because that's the purpose of it. It should be 100% kung pwede. All the air should be filtered through these areas. So kung hindi ka nahihirapang huminga, not all the air that came into you is filtered. So this is good for hospitals. If you are in front of a person who is sick, use N95. So the suggestion is all hospitals should provide N95 for the employees. Nahirapan nga ako.
Yun ang nasa hospital.
Pang-hospital po.
N95. Kasi mas maraming stock yata yung ordinary na mask.
Yes, cheaper ang surgical mask. Much expensive ang N95.
To Secretary Lopez, ina-address niyo na ba yung shortage at saka yung setting the standard retail price nito at wala pong hoarding? Hinuhuli niyo ba yung mga nag-hoarding nito?
Yes, Mr. Chairman. Nung umpisa pa ho, about 2 weeks ago, we started to monitor first the prices and then the supply of surgical masks. So at that point, ang ating SRP, also as prescribed by the DOH, nandun tayo sa 1 peso to 8 pesos per mask. And we were able to catch about 18 violators and inisyohan po yun ang notice of violation, and all those notice of violation after 48 hours will be converted into the filing of charges against them. So they are now being heard at the Fair Trade Enforcement Bureau, can be subjected up to about 300,000 penalty per store per violation. The current problem is less on the price but on the supply. Marami ho talaga nag-out of stock simply because of the sudden the surge in the demand. Marami talaga nag-demand, some can be considered panic buying. And the normal inventory ng ating mga drugstores are not that high. But once na out of stock, these drugstores would normally, of course, reorder to refill their inventories. Now, the recent feedback that we're getting from the drugstore, even their usual suppliers, nahihirapan na rin silang kumuha because abroad, even in other countries, kailangan din nila yung supply. So not all are able to supply them with the desired quantity. So the government had an initiative proactively search for its own suppliers or sources. And the main source that we were able to talk to over the weekend was the lone producer manufacturer of the mask, itong surgical mask, based in Bataan. Isa po siya exporter talaga. But they've been in the country for the past 41 years and they really have been supporting the country. In fact, during the Taal eruption, nagpa-donate din sila 500,000 masks at that time. And then for this, because of this problem, the government's discussion with them, they committed to supply first 100,000 immediate supply, actually to be delivered today, which we would prioritize to give to the DOH. Dahil ang initial requirements talaga priority yung mga nasa frontline po natin, mga health workers, as requested by Secretary Duque. And then that supplier also committed, at least they have the capacity to supply and commit to the Philippines 400,000 pieces per week. And so that is what we intend to add on to the local supply. Initiate lang po yung government kasi nakita namin na pati yung private sector, they're having a hard time sourcing the supply. Importante, we have stocks or supply here in the Philippines. So once they bring the stocks to us, we will make it available first to the DOH and then one half to the DOH and one half to the public through the drugstores para ho ma-distribute natin. So in a month, we can commit about 1 million pieces for the public and 1 million pieces for the DOH requirement. And that can go on as long as we need the stocks. Thank you, Mr. Chair.
Thank you, Secretary Lopez. Can our health and medical experts we invited here confirm if they concur with the statements of Dr. Mata about the proper use of the mask? May we call Philippine Society for Microbiology and Infectious Diseases, Dr. Marisa Alejandria, and is she here? Annalisa Ong Lim, also medical expert, and Dr. Edsel Salvana from the National Institutes of Health of UP.
Good afternoon, Your Honor. Senator Bongo, Senate President Tito Soto, Honorable Senators. Yes, I concur with the wearing of public masks, but with additional information. I'd just like to emphasize again that those who are healthy, immunocompetent, meaning wala hong ibang sakit, hindi buntis, hindi nagkikimotherapy, hindi po kailangan mag-mask. Kung ngayon, sa sitwasyon na may ncov tayo, kung hindi naman din kayo galing sa China o sa mga bansa na merong confirmed cases, hindi kailangan mag-mask kung walang simptomas. Ang advisory sa mga travelers na galing China ay mag-quarantine ng 14 days. So that's mandatory para ma-contain po natin ang virus, para hindi siya mag-spread sa community. Going back to how to wear the mask, okay, importante din po na naghuhugas pa rin ng kamay. Pagkasuot ng mask, yung tamang pagtanggal, huwag niyong hahawakan yung harap. Ang pagtanggal yung nasa tenga. Yun ang hahawakan pag tinanggal. And then wash your hands. Pag madumi na din, palitan na siya, no? Hindi siya pwedeng for the whole 24 hours suot-suot yung mask. So kailangan tatanggalin. Papalitan na pag madumi or 6 hours. At tama po na ang magmamask ay yung pasyente, yung may ubo, sipon. So that's our public health responsibility. If we have cough, colds, kahit na hindi coronavirus, dapat magkonsulta or magmask. Kasi hindi lang naman coronavirus ang matatransmit natin kung tayo ay inuubo or sinisipon. May iba pang mga infection na pwede tayo makuha. Okay. So yun po yung sa mask. Tapos yung N95 naman, sa ospital po, hindi naman lahat ng nasa ospital, yung mga employee ay kailangan naka N95. Yun lang pong healthcare worker directly involved in managing or treating patients, or especially the suspected cases of ncov. Tsaka may mga iba rin po tayong sakit na ang healthcare worker ay nag-N95. Kami po, pinoprotektahan din namin ang sarili namin. So may mga guidelines kami dyan kung kailan kailangan naka-N95. Yan po. And then, I'd like just to say also that it's very, very important yung quarantine kasi nga wala pang local transmission. So, dalawang cases natin imported. So, we really have to exert all efforts to contain the virus so that it does not spread in the community. So, how are we doing that? So, yun nga yung, so we welcome very much the travel ban kasi because of the volume of travel, lalo na marami tayong Chinese tourists. So there's a lot of risk there, no, of getting the infection. So yung mga travelers from China, important po yung 14-day quarantine. And pag sinabing quarantine, nasa loob ng bahay. Yung mga asymptomatic, walang symptoms, dapat sa loob ng, hindi sila lalabas ng bahay for 2 weeks. Yun yung kailangan sundin as a public health responsibility so as not to spread the infection. Tapos yun namang may symptoms ng travelers within the 14 days, dapat magkonsulta at sila yung magmamask. So yun po yung kailangan nating i-implement, no, sa atin mga kababayan.
Thank you.